So communities in Western Sydney typically have a lower awareness of dementia prevention or even the fact that it is preventable. They also have very high risk factors such as obesity, low physical inactivity, not having very good diets. So being able to work in this space and to empower these communities to let them know that dementia is preventable and that they have the power to change their own dementia risk is something that I'm striving towards. My name is Dr. Joyce Siet. I'm a Research Theme Fellow in Health and Wellbeing at Western Sydney University. Brain Boot Camp is a program that aims to target dementia prevention by reducing individuals' dementia risk and raising awareness of modifiable lifestyle factors. Brain Boot Camp was actually voted by members of the public in the Lane Code electorate. We put forward the idea and members of the public voted for it, and the New South Wales government funded us to start in 2019. Ringo was actually the first participant to join the program, and his involvement, as well as many others, is a valuable contribution for us in terms of understanding what worked for them, as well as what didn't work, so that we can refine the program further down the track and create more useful and accessible programs for others.
Could you please tell me your name and your previous occupation?
It's Ringo Seat. I work for Immigration Department before I retire.
You also mentioned too before you retired you worked for the Chinese Australian Service Society.
I think it's probably 1 year after my retirement I started involving, working as volunteer worker with CAS, the Chinese Association. CAS actually has many different groups, and I was involved in teaching English with the elderly group in Ashfield.
So how has Brain Boot Camp raised your awareness about dementia?
I would say that dementia is part of the unavoidable aging process, and as I get older and older, I can feel my physical health is declining. So I'm very concerned about being healthy and being not to catch or not to get the dementia myself.
So obviously coming from a different cultural background with yourself, how important is it to raise dementia to communities from CAS or just around Australia?
In general, I think people from different cultural and linguistic background are in disadvantaged position. They are more or less socially isolated. So the awareness or raising the awareness of dementia is critical for them, especially in their own languages.
So preliminary findings indicate that the program is quite successful. We found that 7 in 10 participants who joined the program had substantial improvements in their brain health after 3 months. And we find also that about 90% of people reported a really valuable experience. They also said that they were now confident in managing their dementia risk reduction. So dementia is a very complex problem. In order to tackle this, you're going to need many people from different disciplines. And so Brain Boot Camp itself was a program that combined psychology, public health, linguistics, computer science, disciplines from national and international groups, as well as involvement from community organisations such as councils, aged care providers and not-for-profit peak bodies to really tackle the question of how we can help seniors to age well. Dementia is a global public health concern. Right now, every 3 seconds, one person in the world develops dementia, which is a pretty scary statistic. We need to be able to tackle this disease and give back quality of life to individuals, particularly knowing that dementia itself is preventable. Everyone has the power right now to change their own dementia risk.